and medical attention to be given for the elderly people. Now, what are the folds of the multifold challenges? So, senior people living alone at home, they are left unattended. For example, if somebody is going to fall, nobody is there to take care of them. Anything can happen. It can be a myocardial infarction or a death, or it can be a fracture, anything. And it has to be mobilized immediately to the hospital. And that is what is a need where Athulya Care Centers do it. We have an ambulance in all the centers. We have trained nurses, doctors to get immediate attention and take care of them. Nutritional support becomes the main important part in elderly people, where there has to be a balanced nutrition. We see people as they grow older, there will be a loss in the muscle mass that is called sarcopenia, and we have to give them adequate protein for them to have the balance and strengthen their muscles. Now, what are the care plans we have here is assisted living. It consists of hypertension, diabetes, dyslipidemia, and people who are suffering of cancer, onco care, and stroke care also. So these people are being taken care like if they are at home, they go for a checkup once a month or once in a couple of months. So the continuity or the care or the readings of the diabetes, sugar level or blood pressure may not be monitored every day. Here in our center, we have people to monitor the vitals every day and take care of them. When there is a raise in the blood pressure, we give them additional medicine to control the blood pressure. And most of the time, de-prescribing is needed for elderly people. May not be needing so much of medication, so we have to reduce when they go in for hypertension. Likely, similarly, for the diabetes, when it is a hyperglycemia, we have to increase the medication, and most of them go in for hypoglycemia, which is a higher risk for, we see many of them going in for hypoglycemia. And these things on regular monitoring and checking up the glucose level, we alter and the medications accordingly so that they don't go on for a hypoglycemia. What happens, many of the death has been reported at home due to hypoglycemia were unattended. Because of the low sugar values, they have been taking these medicines continuously for many months and not revised. So death can also happen due to hypoglycemia, low sugar. We also have transitional care. This is what is very important, where children come from abroad and they wanted to, in some cases like COVID, they'll be suffering of, or cardiac failure, or a fall and a long bone fracture, or even a hip fracture, where they become more immobilized and hospitalized, and they cannot stay in the hospital for a longer period, where that care, the step-down care, will be given in Athulya. We have trained nurses, skilled nurses, and the doctors who are all trained for transitional care. We have doctors, anesthetists, and critical care doctors to take care of them. So the longer stay in the hospital will not be possible. So financially, it will be a bigger burden for the children, and they cannot stay here for a longer time because they have to go to the other country. So this transitional care is, we do it in our setup in all the centers. And the next care is the palliative care. Palliative care is people who are suffering of terminally ill diseases. For example, somebody's got a breast cancer, and there can be a metastasis to other organs like liver, lung, anything. But it cannot be, the condition cannot be reversed or cured. So we take care of them, we treat them symptomatically, keep them comfortable, and increase the quality of life. That is what is palliative care. We do not know when the life is going to end, but the lifespan can be increased. We don't expect to increase as much as it is possible, but we treat them symptomatically and keep them very comfortable. The next very important thing is the care is the mind and memory. We know that as we age, there will be some amount of dementia in many people, and this dementia worsens, and the caregiver also has to be trained to take care of them. And it becomes very difficult for somebody to manage them when they have dementia, because there will be a forgetfulness, short-term forgetfulness and long-term forgetfulness. and they do not know what to do, whether they have taken the medication, not taken the medication, taken the food, or dressing up, they are dressed or undressed. They don't remember anything, and becomes very challenging and difficult for somebody to handle them at home. And this care we have, and we have psychiatric specialists here in all our centers to take care of them. We also have home care services where we send our nurses, and regular visits of the doctor is being done. They have a file like how we maintain in the hospital. So regularly they go and make the entry in that. So it will be easy for a follow-up. We also have personalized care is 24 hours care. We send people like trained nurses, skilled nurses in home care also to take care of them, to be with them. And they are all trained in such a way to give their daily needs to be taken care. Nutrition, as I said, it's very important. They should take a balanced nutrition. So the protein part is very important. And those who have diabetes, the calorie level has to be reduced. Social activities is a regular program which we conduct so that the dementia does not progress on and worsens and go on for a complication. As they get socialized, the dopamine level goes up and the well-beingness they will experience. So these are the facilities where across South in India, we have 10 facilities, 5 in Chennai, 1 in Coimbatore, 1 in Cochin, 2 in Bangalore, and 1 in Hyderabad. So what are the facilities we have it in the room? So the cot is being designed in such a way, it's a clinical cot. You can raise the foot end, you can raise the leg end. So depending upon the conditions where they have aspiration risk, so we elevate the head end and then they feed. And all the floors has been anti-skid flooring so that they don't slip and fall. And they have grab rails across all the walls will have so that they can hold it and walk to prevent fall. And this emergency call bell is in every room kept aside at the side of the bed, so that in case of any emergencies, when they find the giddiness or they wanted to go to the restroom where these people have gait imbalance, they can press the call bell and immediate attention is given. The caretaker or a nurse will go and take care of them. And we have a well-established rehabilitation center in all our centers and facilities where we have trained physiotherapists for seniors to take care of them. Because at the old age, everyone will having some amount of disability to walk, or they come with a fracture or post-operative. So this rehabilitation becomes an important role in elderly people. We have very much trained physiotherapists in all the centers to take care. We have seen many of them coming a bedridden. They walk and they go home. We have a short stay also and a long stay who post-operative come and they will recover, they go home. And other activities are we have spiritually, we take care all the facilities, worship. We have temples in all the facilities where all pujas were being taken care, and recreation areas where they can go and read. We have lots of books kept there and the newspapers, they can go and spend their time there. These are some of the activities to show that how they are being engaged elderly in different centers. Yes. Athulya has been nationally accredited by the National Accreditation Board for Healthcare NABH, and we are the first to get accredited in India. This is we are very pioneer in getting this accreditation, and we also got accredited by the Healthcare Sector Skill Council, and we are working for a JCI Joint Commission International accreditation. We also have running an academy so that we train all our caregivers how to take care of our elderly people, because hiring them from the vendors, they don't work out for our concept. So we train them. We have our own academy. So what is to be trained is we have doctors, nurses, everyone to train them for our concept so that the elderly care, how to look after them. So these are some of the, I think, discounts have been special discounts given for the IIT aluminum members. This part I think the operation people will take it up, the marketing people. You can go through the slide. Yeah. In honoring the old, we honor the path that we ourselves shall walk. Thank you. Made it very short. Yeah. Any doubts? The platform is open for the questions. I'm ready to answer. And our marketing and operation people are also there to answer your questions. என்ன உங்களுக்கு audible இருக்கா?
Attendees can unmute and ask their questions actually. Or else you can post your questions in the chat and the doctor will answer your question.
Questions chat లో.
Doctor, we have a question from Mahavishnu. He has asked, Apollo also has a home services, and he's asking how is it different from Athulya?
Who Apollo?
Yeah.
Apollo, I think they are lacking in a palliative care because last month when I attended a Apollo conference, critical care conference, the ICU doctors were finding difficult for clients who are suffering of terminally ill. They do not know where to send them. So they are yet to start certain care plans. And we are pioneer in giving care for the palliative and hospice cares.
So the difference is we only focus on elders. So most of us staff are very well trained in managing the elder care people, which actually really helps in the overall quality of life and the outcome.
Thank you so much, Satish. And Doctor, we have another question from one Mr. Surya Teja. He's requesting to elaborate on the home care services.
Pardon?
He's requesting to elaborate on the home care services.
Okay,
Okay.
I'll take that question, Rakesh.
Yes,
So we
yes,
do
Satish.
provide home care services. It is available in Chennai and Bangalore. These are the two cities where we have home care services available. So where we have a trained caretakers, also qualified nurses based on the clinical condition and support the patient requires, can be deployed. So they work in shifts of 12 hours to 24 hours. As of now, we are present in Chennai and Bangalore, and we only focus on elder care people.
Thank you so much, Satish. And Sudhita, I hope it clears your query. And Ayush, yes, we will share the recording as well as the slides with you after this event, actually. Okay. Okay. I mean, as Satish said, they are available now in Chennai and Bangalore, right, Satish?
Bangalore for home care
Yeah.
services.
Yeah. And I mean, this is an answer for Mr. Guna Sitaraman, actually. And we have another question from Gopi. What about the specialty diets like lactose-free, gluten-free requirements?
Um, so in our facilities, we have qualified clinical nutritionists. So who actually kind of devise the nutritional plan for the residents based on their health conditions. So this is in sync. It's planned with the primary physician, also with the doctor at the unit, and the clinical nutritionist. The plan is based upon the health condition of the client. So it is very personalized. It's
Thank you so much.
personalized. It's personalized. It is not individual centric. It's very personalized, and also largely depends on the health condition of the resident, and it can be customized. But it's a personalized diet plan.
At the time of
Understood.
admission, a full assessment is done by the physiotherapist, doctor, nurse, and the nutritionist. So thereby they will come to know what sort of nutrition is needed for them. Suppose if they have a diabetes, it is customized for them. And if it's a hypertension or anything else, if they find difficult in chewing, then we have occupational therapists to come and tell them what form it has to be given. So, depending upon the condition, the nutritionist, we have a clinical nutritionist as well as a dietitian, all the centers where they take a detailed history and then they come to a conclusion what sort of food has to be given and what form.
Thank you so much, Doctor. Satish, we have another question from our Vice President, actually, Mr. Subramanian. He is asking whether do you have a healthcare facilities inside the campus or do you send the patients outside for the hospital?
Till primary and secondary care, it can be managed at the uh, facility because we have qualified doctors at the facility, and we also have specialist doctor visiting the facility. But when it can't be managed, when it's an emergency or where they require a specialized care, then they're actually shifted to the hospitals.
Yeah, well, I will answer this question.
Yes.
When they need an ICU setup, then we shift. Otherwise, we are competent enough to treat them. We are all experienced people. We have doctors, a critical care doctor, emergency doctor, and an anesthetist, and myself will take care. So when do we shift them to the hospital is a home can have only like 4 to 5 liters of oxygen we can give them, and we don't have a centralized oxygen supply where it could be something a cardiac or a respiratory problem where we have to shift them into the ICU. Only when there is a need for an ICU, then or any surgical emergencies, we send them. Otherwise, we manage by ourselves.
Got that, Doctor. Thank you so much for that response, actually. And okay, that is another question from one Mr. Satya. We have existing doctors who are providing medications to the elder parents. How does Athulya work with the current set of doctors?
Just 1 minute, Nishani here, just one
Yeah.
minute. Athulya team and also my team, some answers you can answer by chat also. I mean, not every question needs to be taken. So those that are very basic can be answered by chat as well. Thank you.
Okay.
Sure.
Thank you.
Okay, can you take this up, Doctor? I mean, what we do when the parents have a regular doctor for them privately? Will Athulya work with those doctors?
No, we don't allow doctors to come here. We have panel of doctors to come and visit. But if it's nearby, we can mobilize them to the primary physician and we can revise the medication. If they wanted to see them, they can go and come back. But the doctors here, we will always revise the medications because we take care of them on day by day basis. So that if it is most of the time we see these people give them some medications where they go in for hypoglycemia very frequently, and we have to adjust it because hypoglycemia, the risk of death also if we kept unnoticed, and even most of them having a blood pressure. When at the time when they go, the doctor sees the pressure will be different. But here we monitor the vitals every day, and that is where we get the actual reading and we adjust the doses. Those who have a primary physician, we don't object them not to go. They can go see them and have their new prescription come here. With the documentation of the new prescription, we can revise it.
Thanks. Thank you so much, Doctor, for that. And there is another query. How long is the typical stay in the campus? So, I mean, I think he's asking what is the minimum timeline to stay in the Athulya?
Lifelong. They can be with us till their life ends. Or we also have short stay. For example, some of them wanted to go abroad. They don't have anybody to take care of their parents. They can come here and stay as a short stay. And other people, we have like now 700, we are 1,000 bedded and almost nearing 1,000. And they are all staying with us lifelong. They be with us. Children come here, just have a look of them, say hi, bye, and go off. And we are the one who's taking care of them. And most of them we have seen, they don't even want to go back. They come for a short stay saying that my father will be here for 1 month or 2 months, and 2 months later when they
Okay.
come, they say, no, 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 I will be here. This is my home. So that much of
Okay.
comfortability they see, because they have many people to come and take care, to speak to them. We have social workers who engage them, though they go and sit with them and talk to them as a family members. And every day there is an activity, every day group physiotherapy is there. And so many activities are there where they, at home, they will be kept, I think, isolated.
Understood. I mean, that's really great to hear about the services what Athulya provides actually. And that's another question here. How do you provide services for people with intellectual disability? And is there a minimum age for a senior citizen care? Two questions actually.
Yeah, we take from 60, above 60, we take above 60.
Okay.
65 is an Indian rule, but I think abroad it is 60. So we allow 60 plus. Anybody can come here and stay.
Okay, doctor. And how do you provide services for people with intellectual disability?
Yeah, we have a psychiatrist and all the facilities. They will take care, depending upon after the assessment, they will take care. And we have trained caretakers to take care of them, because it is very much necessary that these kind of clients has to be handled very carefully. So not everybody can handle. So we train the caretakers in such a way they will take care. And some of the medications to control them when they are very much abnormal or very aggressive. There are medications. And so these part will be taken care by the psychiatrist.
Thank you so much, doctor. And we have another query from Chitti Babu. He has asked, do we have services in Mumbai? I think right now we have only in Chennai and Bangalore. So I think that is clear. And there is another query from Mr. Desikan. He has asked, is there any membership scheme and do you have a full-fledged hospital? The membership scheme will be rolled out in the coming email, Desikan. And as you know, they are a senior care services company and they don't have a full-fledged hospital. They have tie-ups with the hospitals, I believe.
Yes,
Is that
yes,
correct,
Rakesh.
Satish?
Yeah, yeah,
Yeah.
yes, Rakesh. Sure, correct.
Okay. I mean, that's another question. Do I understand that do you have an operation theater facility in the campus?
No, we don't
Do
have.
we don't. Okay.
No. Small suturings, we do it. When it's a major suturing, then it has to be done in a hospital or in a operation theater. Small injuries we manage by ourselves.
That is another query asking for the average cost of the care. I believe this will be rolled out in the coming the next email with the offer what Athulya provides for the alumni, Venkatesh. I mean, everyone is asking about the charges actually. That will be
Uh,
rolled out soon.
sure. Sir.
You want to take it up, Satish, right now?
Okay. Charges usually depends on the facility, infrastructure, and the type of the support what the resident requires. So on an average, it is roughly around starts from 65,000 to 70,000 plus GST.
Thanks for that.
Yeah.
Okay. Mr. Sandeep is interested in taking up the service in Hyderabad. We will let you know once the service starts in Hyderabad, Sandeep.
We already have there. One facility is there in Hyderabad.
Satish, it is available there?
Yeah, facilities available in Hyderabad. Home care services are not available in Hyderabad.
Oh, home care.
Okay. Okay. You want to take it up then? I mean, he's interested in knowing more about the home care services. Okay, the home care services is not available there, Sandeep.
Yes,
Only the
yes.
facility is available. Yeah. Okay. Okay, that is another question. Do you have the facility for patient's mother and attendant to stay? Are you providing accommodation for them? My daughter is a stroke patient and she can neither walk nor speak. Will she be fully taken care for her of her health and monetary matters? This will be required after my time.
Yes, it can be. Yes, it can be managed. So we at people can come and stay with them from morning 9 to 6. So Beyond that, we don't let anybody stay. But if the attendant is a senior citizen, then they can also stay at the facility. They can also stay at the facility with very minimal charges.
Yeah, we have
That's another.
parents aged, advanced age like 95, nearing 100. And their children are also, a few of them we have children also staying with them in the same room or in a different room. So they will be around like 65 to 70 years of old age group. So 90 plus people, parents, definitely the children will also be of a senior citizen age only. So those people, we allow them to stay.
Thank you, Doctor. Okay, and that's another query on the area, I mean, size of the area or personal utilities provided to the people who are staying there, actually.
These are all, so we have options of 1 BHK where people take independently, and we also have 2 BHKs, 3 BHKs where an independent room is provided. So it all depends on the requirements.
Understood. And that's another query on the language part, actually. Will the language problem for senior citizens who can't speak English and Tamil be taken care of? Who gets admitted there?
So we have the ability to serve most of the South Indian languages along with Hindi also. We have people from diverse background residing in these facilities and also from good socioeconomic backgrounds. So language is not a problem.
Few of them are multilinguistic also.
Yeah.
Understood, Doctor. And Satish, can you also state in how many locations it's available in Chennai? Mr. Karthik is asking for.
Okay, we're present in Arumbakam, Perungudi, Pallavaram, Madurai, and Neelangare.
Okay. Mr. Gunasekaran asking to send more information. Gunasekaran will be sending more information on the details and the services from Athulya as well as the point of contact of Athulya also. And if you have any more queries or if you want them to reach out to you, you can fill the form which has been posted in the chat box. We will be sharing that details to them and they will be in touch with you directly. And Mr. Madhu have asked, is rehabilitation part of the care system, in particular for stroke patients with speech and mobility issues?
Yeah, 100%. We do. We have speech therapist, we have swallowing therapist, and for the stroke patients, we have trained physiotherapists to train them. Yeah, and a different type of, we have an orthopedician rehabilitation doctor also to take care of them.
Okay. Thank you so much, Doctor. And there is another query on the home care actually. What is the approximate cost of home care attender in Chennai? And is it based on home assessment? Can we choose one shift or two shifts?
Shift is available. It's possible. Yes.
Sure. Thanks. And Mr. Gunasekhan, you can fill the details in the form and so that they can get in touch with you. Um, okay, if the patient care attendant is required for 24 hours on, can you provide and how much will it cost? This is from Ms. Sudha.
Patient care attendant 24/7. So again, it depends on the you want a caretaker or a nursing. So basis on the assessment, this can be planned.
Thanks, Satish. Ms. Sudha, I would request you to fill the form actually so that I can have an elaborate discussion with them to get more clarity. Okay, and there is one final question. If stroke survivor is 105 kilo and above, and how do you handle people with obesity in general? And if they need two people to handle them, cost vary. Will the cost vary? He's asking.
So yes, we have people already with you said we're managing residents over 100 kilos, so they do require assistance. So at times they require a personalized assistance also. The cost will definitely vary depending on the support required. But yes, we have the capability to manage people with obesity. We already are managing quite a lot of people.
Yeah, we have a
Understood.
team trained by the physiotherapist and physiotherapists there. There is a team to call them when at the time of mobilizing from the chair to bed and bed to chair, or want to walk and all. Because a single caretaker may not be able to handle them because of their more of a weight. So in that case, they can take care of another person also. So it is being we have people trained. A team is there in all the facilities to take care.
Thank you so much, doctor. And there's another query. Will this facility be available for parents, children, life partner, and in-laws? I think if the age permits, it is
Yes,
available.
they can come and stay.
Yeah. And another query, is there is there any daily activities, or they should be on their own and only food? And I mean, they have a lot of daily activities, Celia. I think that has been covered in the session also.
Yeah,
Okay,
100% activities are there. Every day there are activities. We always have a scheduled programmed calendar activities. And the activities are not the same for everyone. For example, people who are having dementia, the activities are different. And for a normal person in assisted living, then the activity is different. And people who are bedridden and wheelchair bound, the activity is different. Depending upon the disability and the capability, the activities have been planned. It's not the same for everyone.
Thank you so much, doctor. And Satish, one query has arisen, that is there any waiting period to get a booking?
No. We have availability of
Thank you so much.
rooms in
Understood.
Chennai. Yeah.
Okay. Thank you so much, Satish, for that. And I think we came to the closure of the questions actually. Thank you so much, everyone. What I will do is I will also send this form in thank you emailer and the feed along with the feedback to everyone who have registered for the event. And you can actually take out the form, the chat box also. Once you fill out the form, I will share that details to Satish, and his team will be in touch with you, and they will be able to help you with all your queries, and any other support you needed from them. They will be able to support you. Also, they are providing a very good discount for IIT Ma, for the alumni and their family and their friends also. You can actually check on that and avail the services. And doctor, thank you so much for volunteering your time and explaining things very clearly for us. And Satish, thank you so much for this.
Thank
And
you
if needed,
for
we can have
everyone who
more.
got connected and listening to us. Thank you. It's a pleasure.
Yeah.
Thank you, doctor. And
Yeah.
I mean, if at all we need, we'll be having more sessions like this so that we can uh, clear out the queries of the alumni. And so
Sure.
thank you so much for this.
Sure.
Yeah.
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 Thank you everyone for joining us late in the evening and
Yeah, we'd
taking
like
up
to
this
thank
session.
you,
Sure.
the IIT Ma, Nishani, and Rakesh, for putting this together. Thank you so much. This was helpful.
Thank you. Thank you so much, Satish.
Thank you.
Thank you
Thank
so
you.
much, doctor.
Thank you.
Thank you.
Yes.